I've always known that I wanted to be a nurse as far back as I can remember.
I worked in the service industry for about 20 years. Really enjoy the aspect of working with people and interacting with people.
I had a class that was kind of a career development class, and I knew I always wanted to help people. My aunt was a nurse, so she kind of started to steer me in her direction.
The best thing about working at Oakwood is that I have flexibility. I can not only be a nurse and a student, but a wife and a mother.
I find that I can schedule my work around my life instead of my life around my work, and it gives me more time to spend with my family and my children.
Hello, and thank you for considering Oakwood for the next stage of your nursing career. Whether you're a recent graduate looking for your first position or a more experienced nurse looking for greater opportunities, Oakwood offers the flexibility, development opportunities, and rewards to fit your needs. What's more, Oakwood's culture, based on our mission, vision, and values, creates the environment nurses require and desire to do their best work. One of Oakwood's core values is compassion. This supports you as an advocate for your patients and their families. It also fosters collaboration with physicians, staff, and your colleagues to make your job easier and more satisfying. In the next few minutes, you'll meet nurses in a range of roles who can speak from experience about how Oakwood helps them reach their personal and professional goals. Thanks for joining us.
One of the great things about working at Oakwood is my fellow employees. They're very supportive, and as a new nurse, that helps me a lot.
I am a new grad, and being in the ICU is kind of intimidating, and the staff has been, for me, they're 100% all the time. They're always willing to give a helping hand, answer any questions I have without any hesitation.
There's all kinds of different technology at Oakwood that helps me to do my job better. We just recently got these computers on wheels. They allow us to take the computer right to the bedside to, whether it's to assess a patient, to get them admitted and ask all the questions, or distribute medications. We're also able to keep all of our medications right there. Oakwood offers a residency program that helps new nurses. We are offered it once a month, and we all meet together. We discuss any problems we have on the floors, any concerns or questions, and then afterwards we're able to give suggestions and help each other out any way we can.
Oakwood has many programs that allows for the growth of our staff, nurses in particular. We have the BSN completion program. We have multiple affiliations with colleges and universities to bring nursing students here and to grow them professionally and develop them. And we have annual educations, and we have in-services. We have a very excellent cooperation with the nursing education department that monitors the growth of our nurses wherever they're at the Oakwood system.
Here at Oakwood, I think nurses play a very important role in collaborating with physicians in patient care overall. While traditionally the physician is the captain of the ship doesn't sail very far very well without a good crew. The nurses are there 24/7. And they are really the eyes and the ears of the physician.
Doctors here are very nice. You can ask them questions anytime. There is a mutual respect between the nurses and the physicians. Every morning we round with the patients, come up with game plans, and there we can bring up comments or concerns to the physician about the patient care. And especially with the nurses being more interactive with the patients and being more in tune with them, we can act as a conduit between the patient and the physician.
Managers and staff at Oakwood are part of the same team. Part of our daily rounding is not to only round on our patients, but we round on our staff as well together. So that's part of the open door policy where manager and staff take ownership of their issues and collectively resolve those issues and matters as they arise.
What works best for me is the team relationship. It's not manager and staff or staff and manager. We are all here in the best interest of the patient.
I'm a clinical coordinator with the Physician Practices Division. I provide education and competencies to the staff. I also make sure that everyone has the skills that they need to deliver quality patient care and patient needs are taken care of. I chose to work in the Physician Practices Division as opposed to the hospital, mainly because I wanted no holidays, no nights, and no weekends. I have a young family at home and I wanted family time. I wanted to be able to go home and spend time with my family but still be a nurse. Oakwood offers numerous opportunities for nurses to work in the non-hospital setting. We have the Oakwood Common Retirement Community. We have our Home Care Division, Skilled Nursing Centers, and our Physician Practices Division. Oakwood offers many options to fit your schedule and your interests.
Oakwood Staffing Solutions is a nursing pool. I am an Oakwood employee and I float to different hospitals throughout the system. Basically, they give you the flexibility to schedule yourself when you want to work, and they place you where you're needed. The other benefit is I get a higher rate of compensation and I have to work less hours so I can spend more time with my family. And I also like to float to different facilities and work in different places.
I've known I've wanted to be a nurse since I was very young. I had a cousin who was diagnosed with cancer when he was 2, and just seeing the difference that the nurses made in his life on an everyday basis when they were in the hospital, doctor's offices, whatever, made me realize that I wanted to make a difference in the lives of people, my patients, that I could see every day. The Clinical Advancement Program, or CAP, at Oakwood is a recognition for special nurses who go above and beyond their normal shift.
The benefits of the Clinical Advancement Program, or CAP, are that nurses can be out in the community and to help others, as well as build their professional portfolio and further their academic education if they choose.
For example, I've done some projects, some literature reviews, and presented the information to my peers, and that gets me an extra step towards my CAP.
Relationship-oriented care is a theory of providing patient care using the patient and family goals and setting those goals with them and then working as a team to accomplish those goals.
Rather than trying to get through my day, doing all my duties, doing my meds at 10, 14, and 18, I'm thinking about what the patient wants.
The other benefit are the care boards at the bedside. And that's where you write the nurse's name, the doctor's name, the nursing assistant, you write the goals for the day. And you're able to focus on them. The patient's always able to look at them.
From there, I can alter my care so that I can meet those goals and so that my patient is ultimately satisfied with the care that they receive at Oakwood.
Nursing excellence has 4 components. One is scholarly activity, learning and developing yourself as a professional. Another one is evidence-based practice, using evidence or research to be able to be the best we can as we provide care to our patients. Relationship-oriented care is the third part of our nursing excellence focus, and that's really building and developing a relationship with every patient and family member so that they uniquely have a very positive experience when they're in our organization. And then the last area is performance improvement. Oakwood's really been on the journey for magnet status designation for the last 3 or 4 years with our strategic plan. Magnet designation is a gold standard approval from the American Center for Nurse Credentialing that really demonstrates that we are the best of the best in terms of nursing care delivery. We have focused in nursing retention, nursing engagement. We've really focused in our clinical practice areas as well. But like our pursuit of Baldrige, like our Michigan Quality Award winner status, this is not just an award, but it is really the way we do work at Oakwood in nursing. You and I, together, we're excellent.
You and I,
Together,
we're learning.
You and I, together, we're collaborating.
You and I, together, we're compassionate.
You and I, together, we're caring.
You and I,
together,
We're nursing.
We're awesome.
We're Oakwood.
You and I, together, we're nursing at Oakwood Healthcare System.